known two people that have personally suffered from this disorder and have died from this. Spinal muscular atrophy is a rare disorder that is beginning to affect more people today. It's currently, and it deserves more attention. Not very many people know about it. They know more about the muscular dystrophies, but this is a totally different thing. Well, today I'm going to tell you what spinal muscular atrophy is, the symptoms that occur, and the diagnosis and treatment of this disorder. Like I said, I've personally known two people that have suffered and died from this, but I got the rest of my sources from outside information. One of my sources was the book titled NORD, which stands for National Organization of Rare Disorders. It's the Guide to Rare Disorders. And in this book, there are many different doctors that have written different articles on the different medical disorders. And my article on spinal muscular atrophy was done by Barry Ressman, who has his MD. Another source of mine, I did a personal interview with a lady named Peggy Schaefer, and she is the grandmother of the two babies that I know that died from this. And my other source is a website, an organization. It's titled Understanding Spinal Muscular Atrophy, a Comprehensive Guide, and it's found on www.fsma.org. Spinal muscular atrophy is defined as a disorder in which muscles progressively lose their strength and deteriorate over time. It mainly affects the muscles along the spinal cord and the abdominal muscles, but it also can affect muscles in the legs and around the lungs, around the heart, and other muscles as well. The statistics I found is 1 in 6,000 births are affected with spinal muscular atrophy, and this was found on the Families of Spinal Muscular Atrophy website. Another statistic I found was 80% of the 1 in 6,000 births fall into the severe category. Just note that there are different categories of spinal muscular atrophy. There's type 1 through type 5, and I'm mainly talking about type 1 because that's the most severe. And this statistic was found in the website, or not the website, the article by Barry Ressman, who has his MD. Okay, next I'm going to tell you about the symptoms that occur with spinal muscular atrophy. The main symptoms that are evident is that you have a lack of motor development, and your muscles are really weak, and you can see them progressively deteriorate over time. Especially in infants, they have trouble crawling or walking if they actually make it old enough to even be able to walk. They have a very hard time controlling their head and neck, holding it up. They just pretty much have to lay there. They can't do very much. They have trouble breathing, and also they have trouble eating, so it can be very dangerous. My personal example is two twin boys. Their names were Kyle and Cole, and they were 7 months old babies. They were diagnosed with this when they were about 5 months old, and the parents were told that there was nothing they could do about it, just to keep smiling and be good parents, but they would die, and there was nothing they could do about it. They did die when they were 7 months old. I did this personal interview with Peggy Schaefer, who is the grandmother of these twins, and I asked her I posed the question to her, what was the hardest part in dealing with her twin grandson's condition? Peggy Schaefer replied, and I quote, "It was so hard to watch them deteriorate at such a young age. They had such great personalities and always had such big smiles on their faces, but yet they were dying and there was nothing we could do about it." Symptoms, there's a statistic of 70% of the SMA patients lack the tendon reflexes due to this deterioration, and that was found on the article by Barry Ressman also. Okay. Lastly, I'm going to tell you about the diagnosis and the treatment of spinal muscular atrophy. Most of the diagnosis is done before 6 months in the severe cases, but even so, they can find it, within 3 months. If you take your child to the doctor, a lot of people don't realize that this is going on. They think, oh, they're just slow developers, they're not, developing as fast as others, but sometimes this is what happens. And this was found on the Families of Spinal Muscular Atrophy website. There are some tests they can do at the hospital. One is a blood test that just tests the genes to see if they're missing a certain chromosome or if they have an abnormal gene somewhere. The second they can do is EMG, which just stands for, they just test the electrical activity of the muscles to see if they are weakening. And the third one they can do is a muscle biopsy. They usually take a muscle, like a small portion of a muscle out of the leg to check it to see if it is deteriorating, and they can test that. Unfortunately, there are no known cures for spinal muscular atrophy. There are a couple of things they can do child be more comfortable, but there is nothing they can do. They can be put on a respirator to help them breathe because they do have a hard time breathing. And they can also have a permanent feeding tube put in because it is hard to eat and swallow, so they lack their nutrition. So that's one way they can make sure they have their nutrition. In most severe of these cases, they die before age 2. So as you can see, spinal muscular atrophy is difficult to deal with because there is not much you can do about it. So in conclusion today, I've told you what spinal muscular atrophy is, what the symptoms are, and the diagnosis and treatment of this disease. I'm going to leave you with a quote from the organization Families of Spinal Muscular Atrophy website, and I quote, "It is so hard to accept the fact that with so many modern medical advances, there is so little help. The medical field has yet to find any drug, therapy, or